Okay, suppose that we have two beakers here, and in these two beakers we have unknown volume of water. We know that this beaker has more volume than of that beaker here on the right, but we don't know exactly what is the volume of the water in these two beakers. And so to measure the volume of the water in these two beakers, we dissolved 100 milligrams of a colored substance in both beakers. Then we took 1 milliliter from each beaker and we measured the concentration of this substance in it. Okay, what is the concentration? It is the amount of this substance dissolved by the volume of the fluid it is dissolved in it. And as we can see now, the solution in the beaker on the left looks diluted, while in this beaker it looks concentrated. And that's because the volume of water on the beaker on the left is more than that of the beaker on the right. And by looking at the equation of concentration, we can find that volume is inversely proportional to concentration. So the solution in the beaker on the left has less concentration than the beaker on the right, although they have the same amount of substance, the 100 milligrams, because the volume here is bigger than the volume here. Alright, okay, suppose that we measured the concentration in the beaker on the left and we found it to be 1 milligram per milliliter, and in the beaker on the right it's 3 milligram per milli. So here there is 1 milligram of our substance per 1 milli. So how millis are there for the whole 100 milligram? This is a simple cross multiplication, and here we have 100 millis of water. In the other beaker there is 3 milligrams per 1 milli, and by the same cross multiplication we would find that we have 33.33 millis of water. So the water here is more than the water here. So this is less concentrated than the solution in this beaker. And by this same idea we had discussed, we can measure the volume of fluid in which our drug is distributed. How can we do this? We give a known amount of the drug. Then shortly we take a blood sample and then we measure the concentration in this sample. And by dividing the amount of the drug we gave by the concentration in plasma, which we measured shortly after giving the drug, then we can measure the volume of distribution. But wait a minute, there is a problem in measuring volume of distribution that way. Look at these two beakers. What if our colored substance isn't uniformly distributed in water? Suppose that, for example, in this beaker on the left, if our substance settled here. Settled at the bottom of the beaker. And we took the 1 milli sample in which we measured the concentration. We took it from the bottom of the beaker. Since our substance settled here at the bottom means it is concentrated here. So when we measure the concentration, we would find it very high, and that would result in getting small volume when calculated, despite the volume of the water in this beaker is large. But because our substance settled at the bottom, it gave us a false high concentration. So we got a false value for the volume of the water in that beaker. And the same can go in this beaker. Suppose that in this beaker on the right, our substance floated on the top of the water. And we again took the sample, our 1 milli, from the bottom of the beaker. We would get a very low concentration, and hence a large volume of water, which is also not a true value. These false values we can also get when measuring the volume of the distribution of a drug, because our drug isn't also uniformly distributed in our body fluid. For example, it may be concentrated inside tissues. That means it is found mainly in the compartment of intracellular fluid. Remember that the only fluid compartment we can measure the concentration of the drug in it is the plasma compartment. So, when we measure the drug which is retained in our cells, we would expect that it would have low concentration in plasma. It's not uniformly distributed in our body fluids. So when we calculate the volume of distribution of a drug that is concentrated inside cells, we would find its value to be large because the concentration is low. And this value could reach, in some cases, for example, 500 liters or even more. Is that logic by any means that the volume of our body fluids to be 500 liters? For sure no. So we better call that volume of distribution apparent volume of distribution, because it's not a true value, because our drug is not uniformly distributed in body fluids. But despite the value of volume of distribution isn't real and it is apparent, it gives us indication about how our drug is distributed. So, if a drug has large volume of distribution, that means its concentration in plasma is small. So, this drug could pass our tissue cells and it's concentrated there. This drug could pass cell membranes easily. It's now concentrated in our tissues. And on the other side, a drug with a small volume of distribution has a large concentration in plasma, and it's concentrated more in plasma, not in the tissues. Okay, would this drug with high VD expected to be highly bound to plasma proteins or not? For sure no. If it was highly bound, it wouldn't be free to pass to the tissues. So, a drug with a high VD is sequestered in tissues and not highly bound to plasma proteins. Okay, what about the eligibility of this high VD drug for hemodialysis? Hemodialysis is a process done to kidney patients to remove the waste from their blood. So, if we got a toxicity from a particular drug, we can do this hemodialysis to remove this drug from the blood. So would this process be beneficial for the treatment of toxicity of a drug with large VD? For sure, no. Hemodialysis is for the removal of the drug from the blood. The drug concentration in blood is very small. It is sequestered in tissues. So hemodialysis wouldn't be beneficial in that case. Okay, again, what about the half-life of this large VD drug? Would you expect the half-life to be large or small? Half-life, or T-half, is the time required for a drug to reduce to half of its initial value. And now this drug is sequestered in tissue. So it would be expected that it would take longer time to reduce in its amount because it is sequestered in tissues. So we would expect a large T-half. Now, let's have a look on drugs with low VD. These drugs would have a small T-half. They would be found mainly in the plasma compartment, so they are highly bound to plasma proteins, and they are eligible for hemodialysis to treat toxicity. Now, we had finished our second topic in pharmacokinetics, which is distribution. Let's start discussing metabolism, or what we have called biotransformation.